We've talked before about how the side effects of chemotherapy can be very diverse and can vary from person to person. One major side effect that many patients experience is stomach problems. To put it another way, nausea and vomiting. And indeed, from the body's point of view, it makes perfect sense, because substances in chemotherapy can trigger quite a strong reaction in the body, and for the body it's like, get that out as quickly as possible. Most people have experienced that even before an illness or before chemo, for example, when food was spoiled, because then the body thinks, better get it out, right? Before Aunt Erna's egg salad causes even more damage. And it's actually quite similar with chemo as it is with spoiled egg salad. So if you've ever thrown up in your life, or if you've ever felt really, really nauseous, then you probably don't have much desire to go through that again, right? And maybe it won't even come to that, because nausea and vomiting can occur during or after chemotherapy, but they don't necessarily have to. The occurrence of these side effects actually depends on several factors. For example, on the combination of medications, the dosage, and your individual predisposition. And often doctors or nurses can even assess before the chemotherapy whether the treatment is likely to upset the stomach more severely or not. So it's definitely worth asking in advance so that you're well prepared for everything. There are also various and, most importantly, highly effective medications against nausea and vomiting, so-called antiemetics, that's the medical term. So, and as always, you or your child don't have to endure the nausea, right? You can always tell someone at the clinic if your child or you as a teenager are feeling sick or have to vomit. You should feel free to ask for medication against it and of course accept it as well to make you feel better. And to accept the medication is important because enduring persistent nausea can cause the brain to store that experience and, so to speak, learn from it, yes. The brain then remembers, aha. During the last round of chemo, I didn't feel well at all. I felt really nauseous in between. So, and the next time, meaning during the next round of chemo, the brain basically sends out the signal in advance. Okay, now it's time for nausea, because it has learned that chemo equals nausea. It's a bit like people who, at some point in their lives, once threw up during a long car ride, you know. They often can't go on long car rides for the rest of their lives because it left such a strong impression. That's actually called anticipatory nausea. Sounds super smart, right? Anticipatory nausea or anticipatory vomiting. But as I said, there are very good medications available today to counter these side effects, and you can use them with confidence. So what else can help? Many people find it helpful during this time to switch to small, light meals and to avoid all strong smells that they don't tolerate well. Some patients also benefit from aromatherapy with pleasant scents. Essential oils from lemon, for example, are great. Love this smell. And orange, just a little dab. Of course, they also come in small bottles as aromatherapy. Smells really fresh. So if you're interested in the topic of aromatherapy, feel free to ask about it on your ward. I think it's great. So, and otherwise, I can only recommend get some good rest, yeah. As parents, make sure your child can rest now if he or she feels like it. It's really totally okay to treat yourself to an extra dose of sleep or just want some peace and quiet. And it's also perfectly fine if you don't eat or don't eat much for a couple of days, yeah. But it's important that everyone on the ward is informed and that you or your child, if necessary, receive fluids, salt or glucose via IV to ensure proper care. So, and of course the same applies at home, yeah? In some cases, lingering or recurring nausea after the end of the chemo block can also occur at home. But the same applies here. No one has to just endure it, right? Because there are, of course, medications for use at home or for the way home that can help you or your child. That could be a suppository, a coated tablet, a syrup, whatever it may be, so that you can feel reassured and hopefully won't need these here. Even if they're made to look funny, oh, hello kitty, or you can still keep them on hand just to be safe.